Welcome, Tony, to our podcast today. I'm Melissa, one of the committee members in the Australian Health Promoting Schools. So I would like to welcome Professor Tony Rossi from Western Sydney University. Tony is the Deputy Dean in the School of Health Sciences and one of the team members of the ARC project on teachers as health workers. So Tony, firstly, can you tell me a little bit on what teachers' health work is all about?
Sure. Well, the project came into existence because it was quite apparent from our visits to schools and our other important connections to the schooling system when I was at the University of Queensland that the nature of teachers' work was being extended beyond their sort of day-to-day curriculum delivery work and their normal supervisory duties in playgrounds and bus duties and so on. And this seemed to be increasingly including a range of what we might call health and wellbeing tasks around children's connectivity, children's mental wellbeing, a whole raft of policy matters around how to deal with particular incidents in schools and so on, and therefore the necessary, if you like, being informed about children with particular needs within particular schools. So we thought, okay, whilst we know this is happening, we don't know to what extent, and in a sense, how much of a teacher's day it might take up, or how much of a proportion of their overall time as teachers is this consuming. So we wrote a proposal for the Australian Research Council, and we got the money, and we set about a 3-year project trying to get a strong sense of what it was that teachers were doing and indeed how we might categorize that work. And one of the features of the project was, could we actually assign a dollar value to this work? And we got one of the UQ economists on the project to help us with that component. And then it turned out that yes, you could ascribe a dollar value to the nature of that work if it could be described cleanly enough. And so we set about doing that. We set about interviewing teachers, but we also did time use diaries to try and capture not just what it was that teachers were doing and how we might categorize that type of work, but also how much time they were spending doing it. And then the economist and the team was able to, if you like, put a dollar value to it. And it one way that you could think about this was, if this was construed as health work, and that is work that was associated with the health and well-being of young people, what could we argue that was part of the educational budget that was potentially cross-subsidising the health budget? It seems like a long straw to draw, but in actual fact, we were able to demonstrate that the type of work that might be construed as health work going on in the schools in Queensland, in particular, we didn't scale this up to national, but across the schools in Queensland, actually represented a very, very significant dollar value, and we could potentially say, okay, that was. It wasn't so much money being taken from the education system, but it was work being done that was being paid for by the education system that was being attributed to what we came to describe as health work. So that's how the project came about. That's sort of the way we went about it. We did lots of interviews with teachers to get a sense of the work they were doing. We watched them work and did time use diaries. And we also did a lot of analysis of documents and pictures that were posted around schools that were associated with health and wellbeing for young people.
Okay, thank you. That's a good, comprehensive sort of idea of that particular project. So how do you think, health teachers' health work is going to look like in schools? A bit more explicitly.
Yeah, okay. Well, it varies from school to school, inevitably. And I suppose some people might argue, and we did in the book that emerged from the project and the papers that we wrote about it, that one could argue that this was the work that was already been done under the auspices of pastoral care. But it was clear that the old pastoral care model really wasn't accommodating the kind of vigilance that teachers had to have around youngsters' well-being. Were they lonely? Were they at risk? Could any risks be identified from the lives children had outside of schools? Were there any medical requirements that teachers had to be across and potentially know how to deal with in an emergency? Were there other matters associated with, the relatively conventional, but I suppose no less important things around how children were managing their lives in terms of diet? Were they adequately active? Did they have the kinds of opportunities to be active? Were schools providing those kinds of opportunities? And some of this was, of course, embedded in the curriculum, as we might imagine. And some of this obviously took place outside of the classroom, and if you like, beyond the conventional sort of learning spaces as we tend to think of them. I think we didn't do things like have, or at least we weren't aware of, and we know that it's not really something that teachers do. Administer medicines, that wasn't the sort of thing that they were doing, and indeed that's not something which is allowed under most educational authority rules and requirements. But they were monitoring youngsters in a much broader sense. And monitoring sounds like a bit of an overwhelming word. That they didn't have these kids under surveillance, but they had to be vigilant. That young people were in a sense, as well as they could be, and were there any signs of that being otherwise? And if so, what were the reporting lines? How did they find out if kids were okay? What were the records they might have had in schools, and so on? So, in a sense, the work became quite comprehensive. And some of this stuff you might think, okay, that it was right down at the health and safety level, sort of pretty old and typical school rules about not running in corridors, right the way sort of up indeed through the curriculum around how children might make healthy choices both in and beyond schools. So we realized that the spectrum, where that was a word that we used, of health work was actually quite diverse. And Louise McQuaig, who was in the research team, sort of came up with this idea of a health spectrum, which seemed to capture the kinds of work that teachers were doing in schools that were, if you like, identifiable and therefore were able to be categorized. And that spectrum can be found in the book that emerged out of the project.
Do you want to tell us what the book is?
The book is called Teachers' Health Workers. That's its main title. The authors are Louise McQuaig, Du McDonald, Emma Enright, and myself. We were all, during the course of the project, at the University of Queensland, and the book actually came into publication and was released. Some of us have moved on a little bit, but that project was housed and run by staff at the University of Queensland.
Okay, so to end this off, how do you think this research is significant to teachers?
Yeah, look, I think that's a good question. We did realize probably fairly quickly the degree of, in some cases, stress, in other cases, increases in degrees of responsibility that this was placing on teachers. And some of the stories, and I think, again, in the book, we capture these stories really comprehensively, perhaps more than we do in the research papers that we wrote. It was clear that teachers, in some cases, really felt the burden of this. Other teachers, and when I say burden, I don't mean it was a burden that they didn't want. The burden they considered to be important. It's just that they took that burden outside of the school with them, and it sort of played on their own health and well-being. Other teachers simply saw it as an obligation and a responsibility, and were able to separate that from their home lives. It sort of depended on the school. It depended on where the school was located in some respects. But all schools, regardless, right across the educational sector, right across the socioeconomic index, we saw, and we had many schools which spanned those divisions and categories. Pretty much all teachers were engaged in this type of work. The reason it's important, I think, is that we do have to understand that teachers are under enormous stress, and this seems to be adding to it. The level of responsibility now for children's health and well-being, particularly as we're beginning to increasingly understand the level of mental health challenges that young people are facing, it adds to the intensity of teachers' work. Now, can we actually do anything about that in terms of pay or conditions? Well, that's not something we can answer here, but what we can do is highlight the conditions under which teachers are working and the challenges that they face, and where it might be necessary for teachers to go for support for themselves, or indeed how broader school systems and individual schools might manage this in terms of how they support their staff. Most schools, pretty much all schools that we went to, were really supportive of their staff. They tried their level best to ensure that they had a range of commitments and obligations in terms of teaching across different age groups, different types of youngsters, different diverse needs, and so on. But sometimes we do forget that the more burdens you add to teachers' work, potentially the less effective they become. And it's unfair, I think, to simply assume that teachers can take on additional burdens and that there'd be no cost. There is a chapter in the book that talks about cost. Some of it is around financial cost, and some of it was about the cost to individual teachers themselves. And it's a compelling chapter in the book, and that alone is worth reading, I think, by people who make decisions about what it is that teachers do under the auspices of their job.
Okay. Thank you very much, Tony. I think, hopefully our audience today have got, a bit more understanding on teachers' health work, and it sounds very interesting. We will be very keen to have a read. And I thank you so much for your time today.
Okay, you're welcome. Thanks for asking me.
Okay, no worries.